of the growth of the maxilla and increased growth of the mandible. This is how this appliance basically works. So we're looking at about a 4 millimeter correction of crowding. We're looking at any severity of overbite and overjet, provided they have similar growth vertically and horizontally in the jaws spaces, and TMJ function as long as they have overbite and overjet present. So now we're going to take a measurement of the teeth. So we're going to measure from the distal of one lateral along the incisal edges to the distal of the other lateral. This happens to be about a 3.5 or maybe a 4. If there's no crowding or spacing, we would put that size in the mouth. That size should also fit the lower teeth perfectly because they're coordinated between the arches. If we had 3 millimeters of space on the upper, instead of a 3.5, we'd put a 4.5 in. Or if they had crowding, we'd put 3.5 to 4.5, or if they had spacing, we might put a 2.5 instead of a 3.5, which would accommodate or close about 3 millimeters of space. We check to see how well the 4 upper and lower front teeth fit. We see if the canines are going to slide down into those sockets, and I really don't care what the back teeth look like exactly, as long as the front teeth are going to fit. The object of this appliance is that the appliance should fit the teeth after they're straight, not before. They won't fit an arch. If there's quite a bit of crowding or misplacement of the teeth beforehand, it won't fit the teeth beforehand, but it will look like it was custom made at the end of treatment. Overjet, here's a boy that has 13 millimeters of overjet and about 8 millimeters of overbite, and by 14.5, the teeth are perfect. He's been out of retention about 5 years, and they've held very well. Here's his beginning position. These are deciduous laterals, but these spaces will close back. The teeth will upright themselves as they come back, and this is the final result at 14.5 years of age. But he's got a perfect class 1 occlusion, perfect overbite-overjet relation, no crowding of the upper and lower incisors, and this is a perfectly treated case. This case would take me at least 3 years to correct with orthodontic brackets, but it took me 11 months with this appliance. But there's no relapse. If I treated him at 12, perhaps we'd get 50 to 70% relapse in this case. Overbite. Here's a boy that has an extremely deep overbite. He has several baby teeth that are coming out, permanent teeth coming in, and he wore this appliance and he got 5 millimeters of correction in 4.5 months. And this photograph was taken 8 months from the start, but the head plate showed us that we had corrected 5.5 millimeters. Then we took the appliance away and the overbite stayed. The position of these teeth stayed because we've created collagenous fibers on teeth vertically as they were corrected, and he also had vertical growth at the same time. Crowding. Here's a boy that has an overjet. He has crowded front teeth treated back to this point. So we've changed his profile, so he's a nice-looking boy at this point. Here he has crowding. We stripped 2 millimeters from the 2 deciduous molars. They're larger than the permanent teeth coming in, and he got this correction. This crowded lower dentition, the socket for this tooth isn't here. It's way back here. Socket for this tooth is over here. So the minute we put that appliance in, if we strip 2 millimeters here and here, it'll straighten those teeth out as you see them here. Rotations of lower front teeth. Stripping deciduous teeth is the answer, not stripping permanent teeth. We'd have to strip 3 or 4 millimeters from the enamel, but just an easy stripping of 2 bigger deciduous molars can accommodate this amount of crowding very easily if you start at a younger age, and you can see it here. Here's an upper arch with crowding. We used a headgear on this patient, but very few of the mixed dentition cases do we do that. And the case looks like this at the end. Crossbite of the bicuspid is almost always corrected with the appliance, provided you have sufficient room. And it was corrected to this. In the adults are a little harder to correct because adults have no room for the teeth, they have no growth left, and the game is over in essence. In other words, you have to start thinking of where you're going to make the room for the teeth. So when we take a look at an adult, we can correct up to about 2 millimeters of crowding very easily. But that's not because the appliance can't correct that, it's because there's no space. If we make room for the teeth, we can correct a lot of space, a lot of crowding rather. I have extracted second molars, for example, and used a bumper and corrected up to 7 millimeters of crowding of the anterior teeth. We can correct up to 4 millimeters of overbite and overjet, and we can correct TMJ dysfunction. But you should expect probably lifetime retention because there is no growth left in the child, in the adult rather, and they're going to have to wear this appliance maybe one night a week the rest of their life. We're going to use a white ruler for this, and we measure from the distal of one canine along the incisal edges to the distal of the other canine. This one happens to be a number 7, very large teeth. We put it in, we make sure we don't have gingival impingement any place. We make sure that the upper teeth and the canines fit fairly accurately, and the case can walk out of the office in treatment. Sometimes in the adult, we use other appliances with the case in order to make room. For example, we frequently use bumpers, or we use a headgear, or we might use a quad helix to expand the arch, or we might use a Hawley retainer. But these three can be used in conjunction with the Ortho T. This one has to be used alternately with the Ortho T appliance. So here's an overjet with a partially impacted second bicuspid. We put bands on to give her a headgear, and then we put a bumper to distalize that molar, and we can correct it like this. Here's an overjet and that was corrected without a headgear, back like that. Overjet corrects much more easily and readily than the overbite does. Overbite, here's a boy with a severely deep overbite. Teeth close together. If I put brackets, they'd be sheared off almost at every appointment. He has a canine crossbite. His laterals are in different planes of space from the centrals. This case would probably take me 3 years to correct orthodontically, and it corrected in 4 months to that. I mean, when you look at the amount of change that's occurred, nothing else has to be done to this case. The more severe the adult case is, or the more severe the orthodontic case is, the easier it is for this appliance to treat the case. If you have overjet and overbite, which is very difficult to correct with brackets, it's very easy for this appliance to do that. Very minimal cases, it becomes more difficult with this appliance. So here's a deep overbite, overjet, permanent dentition. So we put a headgear to distalize these teeth and get them back in the profile a little bit, and we brought them back to this point. Here's this same boy with the crowded dentition, full permanent dentition, second molars, closed contacts, 4 millimeters of crowding. We put a bumper, distalized the molars, and in 4 months, it straightened out to that. Here's an upper that has crowding, full dentition, adult dentition. We dried the upper teeth, dried the appliance off, and stuck the appliance to the upper teeth, used a headgear to distalize and make room for the teeth, and she wore the appliance only at night to get this change. Here's a rotational case that has about 3 millimeters of crowding on the upper left side. We put a headgear on to distalize. We put the bow on the left side way out from the face so it would move one side faster than the other. And with 8 months, we got this correction. One appliance, and then the same appliance is used as the retainer. Here's a second premolar impaction. Molar has drifted over it, and so we're going to drive this molar back with a bumper. Very easily done. You can drive that back about 1 millimeter per month. Takes about 4 or 5 months, and at the same time, she's wearing the Ortho T appliance to get rid of the overbite and overjet. And when you get space, the bicuspid erupts up into place. Crossbite of a canine, deep overbite, can be corrected. Not so easy if you don't have an overbite, but they correct very easily with an overbite. Sometimes we have orthodontic cases that have relapsed. If they don't relapse too far, we can bring them back very quickly with this type of appliance. There is some space here, here, and here, which is enough to accommodate this crowding, as you can see it here. Here's a lower crowded case, 4 bicuspid extraction case, with a little crowding at each corner. And we use an X series appliance. We have 3 types of adult appliances. An X that has 4 bicuspids removed, a U which has 2 upper bis, and an N series that has no bicuspids removed from it. So this is the case. And then we have several other appliances that we use. We have a snoring appliance that is used for adults that snore, sometimes that have sleep apnea. We have a habit corrector that can correct thumb sucking, open bites in 8, 7, 8, 9-year-old children. We can correct problems of speech. The only thing it has a hard time doing is expanding the arch. And we make bumpers. We have a soft appliance that's used prior to orthodontic treatment to create overbite and overjet changes and create increased blood circulation around the teeth, which speeds up tooth movement. And then we have a soft appliance that's used between first and second phase ortho. We also have an appliance that's similar to Invisalign that has bars in front and behind. It's a soft appliance with an embedded 45 thousandths wire that you can expand or contract the arches. Has a tab on some of them that you can correct and maintain overjet. So this is used to correct minor rotations where there's enough space for the teeth. Anyway, that is about what we have in as far as appliances are concerned. We do have a diagnostic service, and sometimes we recommend, if you've never used functional appliances before, you take a set of models and you can turn them upside down and Xerox them, send us the facts, mark down what the overbite and overjet is, the age of the patient, and we can diagnose and give you the size of the appliance, how long it will take, and so forth. So this is an easy way to get going if you've never used orthodontic appliances before. Also, we do have specials where you can buy a certain number of appliances and you can get free diagnoses done. And this is not a bad way to start, to maybe have 3 or 4 diagnoses done when you start, and then you get onto it. Once you get onto it, you realize how it's done. But the main thing in the adult and the mixed dentition is to make sure you get motivation of the child. The young child, the motivation is not important. And the young child, you can get any child to wear it when they sleep. That is not a problem. So anyway, it's an interesting appliance. We've been around for about 45 years. We've treated about 3 million children with these appliances. And I have never had a report of root resorption or devitalization of teeth. We do have several studies that have been done on it, which you might refer to. There have been studies done on possible root resorption, which was negative. Other studies on the Night Guide and the Occlusal Guide. So go on to our website. We have about 80 monographs on there that might be of interest to you. So anyway, appreciate your attention.
Thank you.
And time.
How does it end snoring?
How does it end snoring? Actually, let me just go through and see if we make 2 snoring appliances. Snoring occurs because the mandible relaxes, and especially in overweight people that have large neck sizes, particularly men. Sometimes if they have a cocktail before they go to bed at night, it relaxes the muscles and the mandible slips back. And since the tongue is attached to tubercles on the lingual of the mandible, it allows the tongue to go back and partially closes the pharynx, and that allows vibration of the uvula. Now, if it closes completely, it blocks the air passage completely, and that's called an apneic event if that lasts 10 seconds or longer. Some people have a couple hundred of these at a night, time sleep, in 8 hours, and they lose oxygen in the body. And during the daytime, they feel sleepy. They might fall asleep. If they read a book, 2 pages, suddenly they're sleeping instead of reading. Or they sleep at the wheel when they're driving and have head-on collisions with people. So apnea is a very serious situation. And one of the best ways to tell, well, a head plate, you can get an indication. However, it's not the best indicator. If you have a very small pharyngeal opening, that's a sign that they might have problems. The opening should be considerably larger than this. However, one of the best ways is to see how they snore. For example, if they have complete closure, that's what we call apnea. And when you advance the mandible, it pulls the tongue forward because of the attachment to the mandible. and it opens up the airway, so suddenly they can breathe.